Dr. Sunetra Gupta is with us, Professor of Theoretical Epidemiology at the University of Oxford. Thank you for joining us on the programme this morning. Let's talk about the vaccines and the boosters and comparing it and contrasting it with the vaccine for flu, etc. All these things are what people are having to contend with at the moment. Break it down for us. What should we be thinking about?
Well, first of all, we should be thinking about what the vaccine actually delivers. And what we've done continuously throughout the course of this pandemic is take some of the wonderful tools that we have and push them to do what they can't do. So we have, for example, mathematical models, which are fantastic conceptual tools, and they've been pushed beyond their capacity to do what they can't do, which is to predict how many cases there'll be and how many deaths there'll be. We have vaccines which are meant to protect against disease and death amongst those who are vulnerable to those conditions. And instead, we've been pushing them to do what they can't do, which is protect against transmission. Once you take on board the fact that vaccines are supposed to protect against severe disease and death, and this was recognized by many people at the outset, including Kate Bingham, who said, you know, we'll vaccinate everyone over 50, and then that's it, we've done our job. And the vaccines have done their job. They've been superlative in doing their job so far, and we're protecting people against severe disease and death. They were never meant to be used to stop transmission or to allow people in particular settings to make them risk-free. So it is really not logical to use vaccines to protect other people. The vaccine protects you, which, if you're vulnerable, is really a very, very valuable thing. What we really should be thinking... Sorry, yes, go ahead.
OK, so, Professor, I get that. So, from what you're saying, can I extrapolate from that that you don't think that NHS and care workers need to have vaccines unless they want to? You don't think they should be forced to?
I don't think they should be forced to on the understanding, but simply because this vaccine does not prevent transmission. So if you just think of the logic of it, what is the point of requiring a vaccine to protect others if that vaccine does not durably prevent onward transmission of a virus? So, I mean, obviously there are all sorts of ethical and political issues surrounding this, but we can peel it right back to the logic. And the logic is simply not there. It's illogical to foist a vaccine upon people in the hope that you can reduce the transmission of disease. And we've seen that. It's been borne out, for example, in Israel, where cases are rising despite vaccination. The good news is that provided you've protected those who are vulnerable to disease and death, we don't need to worry. So we are unnecessarily inflicting upon ourselves this worry that we will be transmitting the virus to someone who's going to die.
OK. Professor, let me ask you about, in that case, let me move on to boosters. So if somebody has been double vaccinated, they are protected, more or less. But will those elderly people in care homes need to have booster jabs? And will the rest of us?
Well, that's a very good question. You know, again, if you think about, provided we focus on those who are vulnerable, it's a very good question about whether boosters may, in fact, enhance or maintain a longer-term protection against severe disease and death. And at the moment, the decision to try and boost immunity amongst those who, you know, are obviously not mounting a strong immune response to the vaccine seems to me to be a logical risk to take. So there will be some small risk, at least, attached to further vaccination. But what we need, of course, are studies to see whether that small risk is outweighed by the advantage, which may be that it makes protection against severe disease and death more durable.
A final thought before I let you go, Doctor. Absolutely fascinating stuff, Professor. Should 12-year-olds be vaccinated?
I absolutely do not think that is logical at any level. I mean, leave alone the ethics of using 12-year-olds as barriers for infection for the community. The bottom line is that these vaccines do not prevent transmission. So these vaccines do not benefit. In the case of a 12-year-old, it benefits neither the individual, who is not at risk of severe disease and death, nor does it benefit the community. So all we're left with is a risk of vaccination. To ask children to bear that risk, to me, is just simply unacceptable.